Hi, everyone. Hello, it's Friday, November 3rd, and it's day 3 of the November Diabetes Awareness Month. I am Yvette McQueen, MD, a global physician on a mission to educate about health, travel wellness, and disease prevention. So I'm here on day 3 to give you another fact about diabetes. It seems to be the website going in and out, but I'm still here. If it don't record, I'll record again. Okay? So, diabetes, we talk about what is diabetes, the different types. To get your hemoglobin A1C checked, we talked about some symptoms yesterday. So, 1 out of 3 people in the United States have diabetes. So, every third person you meet will have diabetes. That equates to about 30 million people. Diabetes costs the medical system about $174 billion annually to just treat diabetes. And diabetes, we give you some of the risk factors you have about diabetes, but it's not just because you eat a lot of sweets. Everyone thinks, oh, keep eating those cakes and donuts, you may get diabetes. That's not necessarily true. It's just that is not why you get diabetes, because you eat a lot of sweets. I gave you the hemoglobin A1C the other day about checking, and I talked about pre-diabetes. So pre-diabetes is a condition in which you are glucose intolerant, which means that your insulin works, but not as effectively as you want to. Um, just like lactose intolerant, you can have lactose sometimes not. Glucose is not, the insulin isn't working as effectively as it should. Once again, you take in sugars or glucose or carbohydrates, your body breaks it down to simple sugar that goes out into the bloodstream. Insulin is a protein that helps sticks to the cell, pulls it into the cells to give you energy. If it's not pulled in the cell, it just hangs around in the blood. So pre-diabetes, you are at risk of getting type 2 diabetes, where you're insulin resistant, within the next 10 years if you're diagnosed with pre-diabetes. Now, you're diagnosed with pre-diabetes if you can have a fasting glucose. Fasting glucose means you haven't eaten or drank anything for 8 to 12 hours. If it runs between 100 and 125, that's a fasting glucose. Or if your hemoglobin A1C is 5.7 to 6.5, or less than 6.5. Some of the risk factors that put you at pre-diabetes is being overweight, your family history, so mother, father, sister, brother, close relatives with a history of diabetes. If you have gestational diabetes occur while the female is pregnant, and she ends up having high blood glucose levels, or she had a infant that she delivers an infant greater than 9 pounds. They suspect gestational diabetes. Other conditions that increase your risk for diabetes are hypertension, uncontrolled hypertension, high cholesterol, high HDL, where the HDL, or the good cholesterol, is less than 35, because you want it up over that, and you can increase it by exercise. Yes. Your triglycerides are 250 or greater. That puts you at risk for diabetes. Polycystic ovary syndrome. It's where you have many cysts on your ovaries for a female, and any vascular disease will put you at risk for prediabetes, to lead on to true diabetes. Now, some things, tomorrow I'm going to talk about more prevention, but I will give you a quick prevention for if you're diagnosed with prediabetes right now, you can actually reduce your risk of getting diabetes by 58% by two things. Two, not piece, two. One, a moderate weight loss, and that means 10 to 15 pounds. You lose 10 to 15 pounds, which is considered a moderate weight loss. That will actually decrease your risk of developing diabetes. And moderate physical exercise, and that means 30 minutes of physical exercise per day. And that could be a vigorous walk, not a stroll. I want you to walk. Get that heart going. Get a little walk. See my hands pumping. Move the arms with your walk. A vigorous walk, 30 minutes a day. Or if you need to put it into every other day, that's fine. An hour every other day. But give yourself some exercise and some moderate weight loss, and you can reduce your risk of obtaining diabetes by 58%. So that's the facts on day number 3, and tomorrow I'm going to give you some more prevention tips, but at least try those 2 for now, okay? Put that in your nugget, let it marinate. This is what you're going to do. And so I am Yvette McQueen, MD, a global physician on a mission to educate about health, travel wellness, and disease prevention. You can find me on all social medias at Yvette McQueen, MD. Okay, have a great weekend. See you tomorrow to talk about prevention. Ciao.